Welcome to BCS, the Chartered Institute for IT. We've got a very interesting conversation to take place today. We're talking about the 11 million or so people, in fact, we'll probably talk about the numbers, who are at the moment digitally disadvantaged. As you can see on your screens, we have Jemma Waters with us. Jemma is the Head of Responsible Transformation at Lloyds Bank. Henrietta and Mbeah-Bankas, who is Head of Blended Learning and Digital Literacy Project Manager, it's a mouthful, at Health Education England. And we have Adam Micklethwaite, who's the Director of Digital Social Inclusion at the Good Things Foundation. So we'd like to welcome you all, folks. Thanks for joining us today. Before we start, I'm just going to do a little advert. Here it is. We have a campaign going at BCS for IT vital workers. Now, obviously, we're recognising a lot of people doing extraordinary work at the moment. Obviously, with our specialist area of IT professionals, we're looking at those IT professionals that are really going above and beyond, and there's loads of them. So if you go by Twitter, Facebook, or the platform of your choice and use that vital IT worker to nominate people, we really welcome that, because we want to champion those that are doing good work, especially as there are so many of them. So without further ado, I'm going to unshare my screen so that we can properly interact. Has that worked? Who knows? Welcome all.
Like it.
So as you see from our discussion points, let's start off with the numbers first of all, because I know Gemma's got a view on this. It looks like there's about 11 million or so with restricted access to digital services. Is that right, Jemma, or should we be thinking in larger terms?
Yeah, so there's around 11.9 million people in the UK who don't have essential digital skills for life. So what that broadly means is they're unable to do a variety of things that I think many of us on this call will take for granted and be doing day to day. So whether that's searching for information online, booking a food shop, looking for a place on a map. I don't know if you're like me, you're always having to check where you're going, but heavily reliant on text for things like that. But yeah, I guess it's, about 1/5 of adults who, for whom that's just not a possibility. And there's also a further group too who are completely offline and can't access devices, can't turn on an app. Again, a lot of the things that I think much of the UK kind of takes for granted and thinks that everyone else does. So no, I think particularly at this time, it's obviously a real challenge when we're expecting people to, live and work, stay connected, work from home. Actually, for many of the UK, that's just not a possibility.
So Henrietta, your view, do you think we're doing enough to help at the moment?
Well, there definitely needs a lot more needs to be done. So we are starting on a journey, and I think if anything has brought the street needs is very much what we're going through at the moment with the pandemic, which means that it hasn't really allowed a lot of people the choice not to engage with the digital, because certainly for our health and care workforce, which is obviously the area that I am coming at this from, it's very much 1 minute people are able to do things, face to face, and the next minute they're not able to do that. So whilst we had some planned working in place to support the digital capabilities development of our workforce, we've had to speed some areas of that work up much, much quicker. And I think people, once they've been handed the tool because they need to use it, have had to find different ways of learning to use it. But there is still some work that needs to be done.
So Adam, what sort of things are happening at the moment to help these folks?
Well, it's worth saying just before I answer that question that there's a very tight link between people who are excluded from the digital world and other forms of exclusion. Again, Jemma will be able to say more about this, but digital exclusion was already a significant societal problem. It comes with and reinforces different types of social exclusion. You're more likely to be older, you're more likely to be poorer, and you're more likely to have lower skills if you have no or low digital skills. So the two things kind of go together. So people in that position we're already facing a range of challenges and barriers, and there is a range of support out there that helps them to overcome those barriers and to start to build their digital confidence and skills. The most effective way typically that works is through the community sector. We could use the phrase trusted faces in local places. Those are the people that have relationships with people who are unemployed, people who are in poverty, whether it's unemployed or in work poverty, people who need to claim benefits, people who have a disability. So a whole range of community groups and organisations have relationships with those people. And up to the point at which the pandemic began, they were out there providing a blend, I suppose, of social and digital support to help people, get a job and learn the digital skills, to help people progress in their work and gain the digital skills, to help people improve their health and gain the digital skills. So that work was going on. Clearly, we are in a different world now. Estimates of the impact on the charity sector in particular are that the effect is going to be deep and damaging. So there are a lot of organisations out there that are have been under huge pressure, but we have, from our community network across the UK, plenty of stories, really inspiring and heartwarming and incredible stories of amazing people who have, despite the constraints that we're all working under, been able to reach out, find new ways of reaching the people who are who lack digital skills and are now obviously maybe sheltering or isolating or being shielded, and continue to provide that support. They've been doing so remotely. They've been setting up WhatsApp groups. They've been finding ways to reach new people through networks that they already have, and they've been really rising to the challenge. So it's incredible and inspiring to see. I'm sure we'll talk more about this later on in the webinar, but there's more still that we can do to help them.
Lovely. So now, Jemma, you've got more of a sort of, I suppose, a corporate perspective on that. How have you seen things change in that provision just in the last few weeks?
Yeah. So I think, firstly, just I think for a while now, from the corporate sector, there's been a really strong partnership link with community organisations and with local charities. But I think over the last few weeks, I've definitely observed that maturing and coming together in a way that we've probably always wanted it to, actually. So, recognising that coming from a large organisation, across Lloyds Banking Group, we've got 30 million customers, which is obviously, a significant proportion of the UK, but we can't do it alone, nor should we. And also for people in communities that aren't our customers, we need to work together in order to help as many people as possible. So I think what I've seen is, just really organisations coming together who, under the real necessity, the need, the pressure of time, just really kind of setting aside any kind of, laborious bureaucracy type processes and just going, right, we just need to get this done. How can we do it together? And how can we use our different customer channels to profile some of the great stuff? How can we work with our colleagues? And I have to say, our colleagues are doing lots of volunteering remotely, which is amazing, connecting in with different charity organisations to kind of donate their skills and their time, which is brilliant. All of that stuff has been really expedited. I mean, what we're also seeing more generally within the organisation is obviously people's behaviours are changing, the way that people are interacting with the internet. Our data from last year showed that the biggest barrier to people doing more online was lack of motivation. So just lack of appetite to do it, not recognising the benefits, and to be frank, probably just not knowing where to start. So with all of this, we've seen a necessity that's meant that a lot of people who are in the position to have been driven online, which is brilliant. They've got that kind of support and the infrastructure. I think to Adam's previous point though, so many people that are digitally excluded struggle from exclusion in a lot of different ways too, and can't just buy a device. They can't just, bring someone up to find out how to connect to the internet, all of those different points. And I think that for us is the group that we still need to really make sure that we're prioritising.
Yeah. Henrietta, we've done a few of these webinars now, a couple of them about the NHS, particularly the informatics community. They've seen an acceleration in change because it's had to happen that way. Have you seen a similar thing? Have you had a similar experience to Jemma there from your perspective?
So everybody is really acknowledging the speed at which things have changed. I mean, people have jokingly said NHS and the health and care sector have been talking about innovation for the last 10 years, and yet within a space of weeks, we've been able to innovate as much as we could have done over the last 10 years. So we've seen a really fast pace in terms of the accelerating some innovation. I think what has been evident alongside that is the real need for digital skills to actually make the most of the innovation or the technology that's available to us. So it's been very much, yes, we've got all of these tech around, and yet we've got some elements or some parts of the workforce that actually need digital skills to be able to utilize those technologies and innovations fully. So it's very much looking at how you mitigate those to ensure that actually throughout the crisis, people are able to use it. I mean, Jemma made a really interesting point around confidence and motivation. And again, we did a discovery a while back to understand what it is that gets people engaged with the digital world or digital skills. And it's those two things. And it's about developing the skills and the abilities and people actually being motivated to be able to use these technologies and skills. And I think we looked at, before this, we looked at three groups of people. So we were talking about people who were digitally negative. The people that said, go away, digital is not going to do much for me. I don't do tech. And the people that thought about tech as actually, I think it's got its place, but I'm still not quite sure. So your digitally ambivalent group. And then, of course, there is the digitally engaged group who are really excited about tech, who want to innovate. But through this crisis, I think what we are beginning to realize, the digitally negative haven't been given a choice to say, I don't do tech. And whether that is something that we can use from here on with the motivation they've got to be able to build on it rather than people stepping back into old ways of doing things.
Thank you. I think you've led now very neatly into the next round of discussion we should have, which is what other things should we now be doing, should we now be thinking about? Before we just start that, I should have mentioned that on the GoToWebinar panel, there's a little questions tab for the audience. So if you have any questions for our panelists or just general ones, please put them in there and I'll pick them out and surprise everybody with them a little bit later on. Adam, can we come to you on that question now of what are the next steps? What should we be doing next to try and engage these folks?
So there are two phases, I think. There's the current phase, which is the phase of acute needs. So the pandemic is still with us. The lockdown is still with us for the moment. Social isolation will be for a while too. So the needs that people had already are now more acute. So Jemma alluded to this earlier on when she spoke about devices and connectivity. There's a gap there. We know that well over 1 million households in the UK don't have access to a device or connectivity. So there are things we need to do right now to provide relief both to individuals that need access to the digital world and also to organisations that are supporting people to access the digital world. And we're acting in both of those spaces right now. The first thing we're doing is an initiative called Devices.now, which has been mobilised by the Future.now collaboration. That's a collaboration between large private sector organisations, including Lloyds, who've been absolutely brilliant in this regard, alongside BT, Accenture and others, to focus on digital skills. The Future.now focus had been on digital skills for the workforce. At this point, they've pivoted and set up Devices.now, which is an initiative to try and drive out donations of new devices and connectivity, so that those can be distributed as quickly as possible to people on the ground who need them, people who are sheltering in their homes. So we've been working with Lloyds, with BT, with others on that initiative, and so far we've distributed over 1,600 devices to people in need. And again, the stories of how this has changed people's lives are really quite inspiring. The second thing we've been doing is mobilised a Response and Resilience Fund. That's a bit of jargon, but essentially it means we have put money from our reserves as a charity into a fund that we can, with very, very light touch, push out to community organisations that are facing severe financial pressure, but are still trying their best to deliver digital skills and confidence building to vulnerable people in their community. So we've pushed that funding out, and we're focusing on Devices.now. There's a range of other things we're doing too. We've made the learning platform that we have, Learn My Way, which is free and open to anybody to use. It teaches you basic, foundational and essential digital skills. We've made it even easier to use and more accessible. So we've done a range of other things. So that's the immediate phase. But then critically, there's the next phase. And the next phase effectively is open-ended. So this is what comes next. And so we really need to think, and I'm hoping we can get into a bit of this in this dialogue today, about the future. What is going to happen in the future? Clearly, so much is uncertain, but we can make some pretty solid assumptions about some things. So the impact of rising unemployment on the take-up of digital skills learning, more people moving into out of work or in work poverty, the fact that there might be new types of digital skill that we all need. I think the idea of digital resilience, so being able to stay stable and resilient and centered in a digital world, in a world which is even more digital than it already was, and to act well in that context, I think is going to be a real, really important area of work. So that's staying safe online, spotting misinformation, and just taking care of your mental health. So I think that's going to be really important. Just being effective when you're working remotely. So whether you're using platforms like this or just managing a home working environment that's heavily digital, I think will also be a need and an area that we need to focus on. So there might be new types of digital skill, we could say, that we need to start raising up and thinking about. The role of community, I think, is still going to be absolutely critical here. And that's because of this tight link between digital exclusion and social exclusion. So this is broader than just the charity sector. This is libraries, social enterprises, a whole range of organisations, and obviously the formal education and training sector too. So FE colleges, private training organisations, and so on. That role of doing this in the community, really putting digital skills, embedding it into everything that goes on in communities, I think will be really important. And then finally, Jemma's well-made point already about partnership. Digital inclusion has always been an issue that is far too big for any one organisation to tackle by itself. As Jemma said, partners across the private sector and philanthropy and the charity sector and government have risen to the challenge so far, but there is a lot more to do, and I'm really confident and really heartened by what's happened so far, and confident that that will translate into further innovation and further forms of partnership that we can strike that will increase the amount of funding that goes into this space, but also the really good ideas and innovations. So I think it's really important that we look at the future as well as the immediate sort of acute emergency need that's going on right now.
So clearly partnerships are a huge thing there. Jemma, this is something that you're very involved with. In fact, you've got a name check just then anyway. How do you see that medium-term future development?
Yeah, I think to Adam's point around all of the challenges that we can, there's so much that we still can't foresee, but there's some things that are definitely certain. So like Adam was saying, the rise of in-work and out-of-work poverty, the challenges around unemployment and the changing workforce, I think it is for us as organisations to proactively think about how we can work together to develop and tackle some of that. So if I think about some of the things that have been stood up, so Department for Education have pulled together a very kind of crude, kind of MVP of the digital skills toolkit, which I think is really helpful. It draws upon resources across Good Things, Lloyds, but numerous other partners as well. It's kind of how do we evolve that and build upon it and make sure that we've got that kind of we've got almost like a centre of gravity around some of the things that are available to people, but what does it look like beyond and around that? How is it going to change the nature of things like apprenticeships and the apprenticeship levy? Actually, should we be considering how to work together to speak to government about how to change the parameters of that and what that means, and what does education look like now? Because that lifelong learning piece is going to be more prevalent than ever, and I think, as we were saying, we've all got roles to play in that. We all come with very different perspectives and expertise. And I think it's about kind of, organisations being more transparent than ever before, breaking down some of that corporate bureaucracy and barriers to share some of the learning, share some of the stuff that we're doing well, but also what can we all learn from each other? Because I guess the one thing that is, unifying about this whole experience is that everyone's a little bit making it up as they go along. Because we have to. We've never experienced anything like this before. So we need to come together and share learnings and make sure that we're putting societal outcomes and people first instead of thinking separately about specific, silos and objectives. And I think, as Adam was saying, there's lots of great stuff that's kind of starting to emerge, but I think it's kind of identifying those kind of key challenges and the key groups of people that are likely to be effective, thinking about the challenges in their day-to-day lives and trying to understand how that could change over time and trying to be part of that journey, but also kind of hopefully a few steps ahead that we can kind of support as well.
Excellent. So Henrietta, I made a little note here about non-digital provisioning. Is there a danger as we do this that non-digital provisioning might be just sidelined too quickly, or is this a nettle we just need to grasp and get on with things?
So that question is an interesting one, because while non-digital provision has remained, I think it's rather been the perception of individuals that because most things have moved into digital realms, that actually these things do not exist. But they are. I mean, GP practices are still opened. I mean, of course, there is the encouragement that if where at all possible, use the remote triage and online consultation means to obviously avoid having to go and sit at your GP practice. And especially if you're already ill, you do not want to expose yourself to any more vulnerabilities. Having said that, practices are still up and running, or non-digital provision is still up and running. So I don't particularly feel that it's been sidelined. I just feel that the atmosphere is such that people are actually quite cautious about using these existing services, which to be frank, is still, running. It may be reduced service, or for where it cannot actually be delivered as per it should. It probably is not running as well, but I don't think it's been completely sidelined, certainly not from my experience. I think it's more a reaction from what people perceive it to be, rather than being sidelined.
So I'm getting a sense from all three of you that this has actually been a bit of a catalyst, unpleasant as it might be as a catalyst. And we've had that from other webinars we've done as well. Is that your perception of things at the moment, Adam, that actually things are picking up pace, and although there might be some mistakes on the way, that we're actually going in a very good direction to try and support these folks?
Yeah, I do. And I think what both Henrietta and Jemma said is absolutely true. And to a great extent, we are making this up on the hoof. But that is itself a spur to innovation, and loads of people are building stuff at the moment, good stuff that can be used. We've almost started to see a sort of a hyper acceleration of sort of resource development that might otherwise have happened over the last 2 years. So the community sector for one, but also I'm sure the public sector and business as well will be able to make use of these resources. We're seeing some great efforts. I'm thinking of an organisation called Catalyst, who have tried to pull together a kind of bank of good practice around how charities in particular are starting to deliver their services digitally. So this is happening, and it is all coming together, and this is what we do. Humans adapt to situations. So it's really good that we can see so much so soon. But there's still a huge way to go. I mean, we haven't mentioned it so far, but there will clearly be some kind of effect on the numbers we started off talking about in this webinar, from sheer necessity, people having to go online, despite their motivational barriers, despite the other barriers that they might face. Now, nobody knows how significant that effect is going to be. Is it going to be small or marginal, or is it going to be slightly bigger? But nevertheless, that I'm sure some of that will happen, but there will still be a significant issue out there. So despite all the good work going on, there is still a long way to go, and a lot of work to do. And I think there is paradoxically a risk that because the other issues we've spoken about so far, so in particular unemployment, poverty, obviously public health in every way, shape and form going forward for the foreseeable future, will be so dominant. There is a risk that people say, they look at the people that have gone online as a result of lockdown and say, well, that's it, we're kind of sorting the problem. So there's a risk. Maybe it's a small risk, I don't know yet. But there's certainly a risk that paradoxically there's a risk it might get a bit sidelined because the attention is elsewhere, and oh well, the digital will just happen, won't it? And I think we can't allow that to happen. We need to really make sure that digital is centre stage, or at least embedded into the thinking that's going on across all of these different areas of policy and response, to make sure that we do put the needs of people who are excluded from the digital world into our thinking from the start and keep them there. And I'm confident that the great work that's going on now, the partnerships we have, the partnerships that are going on elsewhere, are doing that. But I think it's incumbent upon us all to make sure we continue to sort of carry that broader torch through the coming months and years.
So
definitely, and I think there is a bit of a concern. Oh, sorry.
No, carry on.
I was going to say, I think there is a bit of a concern about complacency, and I also think there is the challenge as well around the quality of being online. So I think a lot of people are saying, oh, it's great because loads of people are getting online, hurrah. But actually, do they have all the skills and understanding and support that they need to do so safely? Do they know what some of the other benefits and some of the other things that they could be doing online are? Because I think there's a lot of folks that, you know, we've spoken to over the last few weeks who are now using video messaging, conferencing, those kind of things. Again, that's great, but actually going from that to doing a food shop actually takes a very different kind of mindset and level of ability, comfort with paying online, understanding the safety around it and all those different points too. So I think it's definitely, yeah, I think my concern is definitely around complacency and supporting people with not just learning for now, but learning for ever.
So, sorry, Adam, you had a point?
No, I was just thumbs up.
You were just drinking.
Yeah. Brian, can I add a point to that? So I think really interesting conversations, and I think for me it's very much, we talk about citizens, and coming from a workforce perspective, sometimes we do separate it out slightly and say, oh, we're thinking about digital literacy or capabilities for the workforce, and the citizens need to learn something else. But actually, if we think about the way that Health Education England defines digital literacy, which is very much the capabilities that fits one for living, learning, working and thriving in a digital society, then I think that's applicable to us as a workforce at some point, as well as being citizens. I think for me, what we have seen now is lots of collaborations, as you've all rightly pointed out. We certainly are making the most of some of the learning that's already in existence, and Learn My Way is one of them. So there are lots of things that we can utilize now. What is critical for us going forward, certainly within the health and care workforce, people are almost always very busy, and it's very much them being able to understand where the gaps are. So, Jemma, you made a really good point that actually somebody may go online, but have they got the digital skills that allows them to think about, do I click on the cookies or do I actually check what this means? So that data, the digital security and things like that. So we obviously going forward as a medium and long term, thinking about a digital self-assessment diagnostic tool that allows this practitioner to actually understand what it is that if they go around information, data and content, what skills have they got now or what skills do they need? And as a result of that, be signposted to learning that's relevant for them. Because what you do not want is everybody learning the same things if it's irrelevant for them. But equally, what's critical is the fact that we do need the champions. So there are people that are motivated, and motivation being key to actually be responsible for their learning, but there are others that need a little bit of hand-holding. How do you support people who are in that position to get some championship, some support to actually get them through the learning that they require? So these are some of the thinking that is going on and some of the work that we are doing alongside what we've seen now, how things have been implemented and what we need to do going forward. Not to also miss the fact that actually it's beginning to get us to reevaluate how we train our health and care professionals in the first place. So are we able to utilize the digital tools that we've got now to train people and socialize them into coming into the workforce with some prerequisite digital skills?
That's interesting. Now, usually our conversation is about half an hour, then we have 15 minutes of questions. We've had our half hour, that's gone by quick, but we've got a couple of other things to talk about, I think. So I'm going to weave in some of the questions with our conversation, if that's okay. And here's one. We recently saw Captain Tom, wasn't it, who raised huge amounts of money for the NHS. But one of the criticisms of that was that we shouldn't start viewing the NHS as a charity, because that's not what it is. So this is a question about where the responsibility lies to get this stuff done. We've already alluded to partnerships. Is enough being done by sort of central and local government to support those things? Adam, can I start with you? Bearing in mind we're an apolitical organisation, by the way, BCS, but feel free to give your views.
Honestly, I feel like it's too soon for me to give my opinion as to whether the government is doing enough or not enough. I mean, you know, there's the public debate at the moment about you know, the speed of response and testing and everything else that's happening. But that's quite a big, broad question. You know, should we treat the NHS as a charity? Clearly not. It should be funded properly and fully, and to the extent that it needs to be to carry out its incredibly vital work. And beyond that, I'm not sure what I can add. I mean, Henrietta may have, you know, views that are closer to the what's actually going on in the NHS.
So I mean, yes, I come at this from different angles, in the sense that yes, sometimes So the responsibility doesn't really rest on just one organization or one individual, because this is I mean, my leadership days will tell me there are wicked problems and tame problems, and this is one of the wicked ones that hasn't got one solution to it or a solution to it. As best as you can tame it so that you've got a number of solutions. From my perspective, however much funding we get or however much support, there is some responsibility on individuals, organization, teams. So everybody has a bit of that responsibility, because, I mean, as Jemma and Adam will know, you can put all the tools and systems in place. If people do not develop the confidence and the motivation to use it, no amount of investment or funding will change that, which is why I think that it's a big systemic there's a big systemic need to address this issue at so many levels. So if I take the program that I work on, which is the Digital Readiness Program, we are coming at this from a number of angles. We're not just looking at individual or profession-specific digital skills, but also thinking about the leadership and leaders being able to appreciate or understand the innovation and creating cultures that fosters innovation and continuous learning. So it is very much looking at the whole system and what role everybody has to play in it.
So can I come down a little bit more to the individual level then? We obviously, BCS, we're an audience of IT professionals. What can individuals do to support in these sorts of processes? Jemma, could I ask you that question?
Yeah, sure. I think, I guess in the first instance, it's about your own friends and family. It sounds really obvious, but actually there are a number of people that you'll come into contact with day to day, neighbours, friends, family, as I say, who might need that extra bit of support. So I think, yeah, it might sound silly, but it's really not, just to check whether the people that you're interacting with have got what they need. I think at that level, that's definitely something that's equally important and can make a big difference. And then I think it's about giving a bit of healthy challenge back to the organisation too that you might work in, because I think there's a lot of conversations that we've been having with people, you know, who work in a number of different organisations. So I think particularly when you're in a tech and digital first environment, people do forget that actually there is this huge proportion of the UK that can't use it. And then I guess for those who can access the internet, again, is it really as accessible as it could be? Is it as inclusive as it could be? Is the journey to find the product or service as simple as possible? I think really stripping it back and asking those questions is really important and could, you know, have a huge effect on the quality of the service you're providing. And also just thinking about what your own organisation is doing from, and what you're able to do from a more kind of community engagement perspective. So there's a number of people in our broader teams who are helping local organisations kind of set up a website, understand what they could be doing differently with their data, all of those kind of things. And obviously there's lots of safeguarding you need to put in place to make sure people are doing things in the right way and there's the right measures around it. But, you know, at the moment, we've been talking in our own organisation about donating your commute time. A lot of people would normally spend, you know, X amount of time on a train into the city, you know, all of the cities that they work in, all of the places across the UK. Actually, whether it's 15 minutes, half an hour, there's lots of brilliant, amazing micro-volunteering opportunities out there, or the opportunity to mentor ongoing. And I think a lot of people that work in tech and digital also always think about what they can't do. So it's, oh, well, I can't do DevOps, or, you know, I'm not a coder. But actually, you know, some of the things that you do every day and take for granted can just add so much value to any kind of, you know, community, charitable organisation, small business at this time. So yeah, I think it's about thinking about the ecosystem and where you could add value, and don't undersell yourself.
Donate your commute time sounds like it should be a hashtag. That's an excellent little phrase. Maybe it is. That's an excellent phrase. Adam.
Yeah, watch the space.
I like that. Yes. I was just going to add that from a volunteering perspective, just thinking about your role in your local community as well. So friends and family, absolutely right. The kind of volunteering from within the organisation that Jemma was talking about, but just as a citizen, we've started to see some really significant shifts in the way communities feel. And again, that's uneven. It's not the same everywhere, but there is that, you know, that groundswell, obviously a really heartening groundswell of support for community action and mutual support. So I would say also, if you are, you know, a member of the public, just generally, just thinking about how you can volunteer the skills that you have and the time that you might be able to create to help others. We have on our website a map of organisations that provide digital social support to people and communities. It's been challenging to sort of keep on top of how many organisations are still operating and how many aren't, because the impact of the lockdown has already forced quite a lot of organisations to close, sadly. We really hope that they reopen. But we've now launched a revamped version of that map, so you can actually go on and find your nearest centre that we know is operational now, that are delivering that kind of support in the community. I mean, if there was one near you, I'm sure they'd be pleased to have a phone call saying, you know, I'm interested in volunteering. There are also plenty of resources out there that can help you to improve your confidence in helping others to use digital technology, if that's something that you're interested in doing. So we use the phrase digital champion to mean a number of different things, but there are a range of resources, some of which we do, some of which other organisations in the same space provide. So Citizens Online, Digital Unite, people like that, which are very, very good resources to help build your own confidence if you're going to take that step and start to volunteer. So there's another hashtag there too.
Yeah, there is plenty of hashtags today. So there's been a very positive underlying sort of feel to this conversation, which has been great. I'd just like to ask you also if you've seen any new things or any things that just caught your eye that people have been doing just to be more engaged or to assist those 11 million people. Henrietta, can I ask you first? Have you come across anything that's just made you think, interesting way of looking at it?
Oh gosh, where do I? I mean, there's been lots and lots. For me, I think what's been the most striking is how generous people have been. So we started off this conversation by talking about partnerships, and I think sometimes we haven't been very good within health and care to really partner with, you know, industry or other areas. And what we're seeing through the pandemic is people have been very generous, and with lots and lots of learning, lots and lots of free offers. I mean, we've had some videos developed for us without being charged for it, to support for the response of this. And I think for me, it's it's not so much about what we've seen that's wow now, it's very much how do we spread this, how do we implement it, because sometimes we are good at developing the innovation, maybe not testing as much or as well, and implementing. So it's how do we go through these stages and ensure that actually it sticks? Because obviously we are doing a lot of these things and we're embracing a lot of these new wow things as a result of COVID-19. So one that I've seen certainly is a Microsoft mixed reality piece that allows training to come straight to the person that's needing it as and when. So training being on hand when needed. That's exactly that's brilliant. That's wow. But it is something that can be adopted, something that can be used, something that will stick, is where I guess my anxiety is. When COVID is done and dusted, are we going to have the same level of motivation to be able to hold on to these innovations and test and implement and spread? It is where I think we need to start putting some effort into the thinking.
Thank you. Jemma, your feelings on things that have caught your eye?
So I think, to be honest, it is the examples of where people have just come together in communities. I think there's lots of brilliant techie type solutions that have been stood up. So I think we talked a bit before about Catalyst. They've got some brilliant service pattern stuff that's incredible. There's another group of folks who've pulled together a bit of a handbook that people can collate and kind of add to. But I think for me, it's just seeing on a very human, personal level, the difference that it makes to people's lives when you take the time to support them with this stuff. And I guess, you know, to echo some of the points we've made already on the call, just making sure that that isn't something that stops beyond this crisis. How can we kind of really embed that in and keep it going? I think without sounding slightly biased, because we're also working on the initiative at the moment, but I think that's where devices.now is really helpful. And I guess that's the only thing I'd add to the question around what can IT professionals do, is considering actually, no matter your organisation size, whether you've only got a few dongles to offer, whether it's a few laptops, tablets, whatever that looks like in your organisation, do think about where they could be making a real difference at the moment, and do check out the devices.now page to see if that's something that you might be able to contribute to, because I think the the stories coming out of that space are just, you know, remind us why we're all doing what we're doing.
Excellent. Adam?
Yeah, so similar really. There are some great tech innovations coming out from the likes of Microsoft and Google and others, and I welcome those, and there will be more, I'm sure. And just getting to grips with them, working out how they can be deployed in a range of different settings will be brilliant work to do. But I think, like Jemma, I would come back to the innovation we're seeing from grassroots, from people, particularly people who are committed community organisers and community activists, really thinking in fresh ways about how to approach this. And I suppose the example I was going to end on anyway, which fits quite nicely here, is the example of working with isolated people already, building their skills through a remote service like WhatsApp or Teams, and then pairing them with other isolated people so that they can go on and share their experience and help build the confidence of those people too. And that's a sort of simple but quite a powerful model, because not only does it help now, but it's hopefully sets up relationships which can survive lockdown and beyond, can particularly persist for people who are shielding and might need to be shielded for a long time. So that sense of creating those extra connections and capital in communities between vulnerable people feels like, you know, frankly, an innovation of the first order, even if it's much more about grassroots stuff than it is about tech. And if it's all right, Brian, I was just going to finish with a quick quote from a lady that's doing that, just because it kind of brings it to life. So this is Marie, who is 79. She's been widowed for 18 months and she lives alone. She's supported by the Crossgates and District Good Neighbours scheme, who are one of the members of the network that we work with. And she says, so she calls 14 other isolated people every week to support them. And she's supporting them over the phone to download Zoom, to access video calls, having had that support herself. And she says, when you live alone, it's hard. When you pull the blinds down at night, it's very lonely and the nights are long. It's great to have something like these virtual activities to look forward to and to see other people, even if they are on the screen. It really cheers me up. I feel so much better getting up when I know I have a virtual event coming up, because I have a reason to do my hair and get dressed up for the day. So I just wanted to finish with that.
Well, that's lovely. Thank you very much. And folks, that's 45 minutes bang on. That's been such an interesting conversation. Thank you for taking part. I know there's lots of other things we can talk about. Perhaps we'll follow up these things later on, because obviously these situations are developing and ongoing. How things work in the medium future is going to be interesting to just keep an eye on, isn't it? And you three have got your finger on the pulse in quite different areas, and we've appreciated your input. So Henrietta, Jemma, Adam, thank you very much. We'll express our appreciation for BCS. Thank you to the audience for listening in and for your questions. I'm just going to put one last slide up. That's okay, because we've got one of these next week. Let me share my screen. Hopefully there it is. Patient data and professionalism. Undoubtedly, this is NHS oriented one, of course. I'm sure we'll be talking about the app. So look forward to that one, and thank you all.
Thank you.
for having us.
Thank you very much.
Bye.
Thanks.
Bye.
Thanks.